Anytime? Okay. Hello and good morning. Thank you for being with us. My name is Dr. Kerry Mothersill, and I'm the incoming president of the Canadian Psychological Association, known as CPA. With me this morning is Dr. Karen Cohen, the CEO of our organization. The CPA is the National Professional Association of the country's psychologists and represents a discipline and a profession that includes researchers, academics, and a range of practicing psychologists who work in industry, hospitals, healthcare settings, a number of government departments, including corrections and national defense, as well as in educational systems, private practice, and primary care clinics. There are about 18,000 licensed psychologists in Canada. CPA's primary mandate is to promote the science, practice, and education of psychology in the service of health and well-being of every Canadian. CPA and Canadian psychologists are very concerned about the mental health and well-being of Canadians. Our concern centers on the incidence, prevalence, of mental health and behavioral disorders among Canadians and the toll that these problems and disorders take on individuals, families, and the workplace, and the substantial barriers that Canadians face in accessing needed, cost-effective psychological services and supports. Today, we are in Ottawa with members of our profession from across the country to speak to parliamentarians of all parties and to the national media about important issues surrounding access to psychological services for the millions of Canadians who need them. The federal government can do a great deal to foster the kind of access that psychological services that are required by Canadians and that they need and deserve. As Canada's largest employer, the federal government has recently made significant strides in addressing gaps in accessing psychological care, and it's important that we acknowledge and applaud that initiative. Earlier this year, Treasury Board President, the Honourable Tony Clement, announced that as of October 2014, coverage for psychological services will double for public service workers and retirees from $1,000 to $2,000 per year. This represents enhanced access for services for hundreds of thousands of Canadians and their families. There are additional ways that the government can and arguably must enhance access to psychological services for all Canadians. To present these in more detail, I'll now invite our CEO, Dr. Karen Cohen, to say a few words.
Thank you, Kerry. My name is Karen Cohen, and I'm the CEO of the Canadian Psychological Association. With more than 1 in 5 Canadians experiencing a mental health problem or disorder every year, access to psychological services is not nearly sufficient to meet the needs of the population. CPA is in Ottawa to advocate for policies which will increase access to the services Canadians need. Psychological services are not covered under public health insurance plans, despite the burden of mental disorders in the Canadian population, on the workplace, and on the economy. Where they are covered by private employer-based plans, coverage caps and barriers usually mean that a clinically meaningful level of care is out of the reach of the vast majority of people who need it. The numbers are staggering. Mental illness costs the Canadian economy in excess of $50 billion annually in absenteeism, presenteeism, and lost productivity. 1 in 5 Canadians will experience a mental health problem every year. Depression is the fastest growing category of illnesses, leading to disability claims to insurers. Within the federal government, 40% of these claims are related to mental health. Mental disorders cost employers as much as $20 billion per year in lost wages and insurance payouts. These costs can be mitigated. As much as a third of employer losses related to mental disorders could be recovered if employees were given timely access to effective psychological services and supports. But barriers to accessing psychological care in Canada are not only limited by funding. When care is accessed through third-party payers, there are often requirements to accessing benefits, such as the need for referral from a family physician, that create delays and barriers not required by legislation or by a psychologist's scope of practice. Recent changes to tax policy also pose barriers to accessing care. A little publicized change in HST rules from Budget 2013 has cast uncertainty on the taxability of some of the health services performed by psychologists in Canada. After more than a year of seeking clarification on the new rules from the CRA, psychologists are still in the dark as to which of their services are taxable and which are not. The CRA needs to issue a clarification on the Budget 2013 changes immediately to rectify this problem. Finally, government departments like Correctional Services and National Defense face significant challenges in recruiting and retaining psychologists. The CPA wants to work with government in addressing these challenges to help get psychological services to those who need it. By participating in training and addressing conditions of work for psychologists, the government could do a great deal to ensure meaningful psychological care for the populations for which it is directly responsible, such as inmates and soldiers. The federal government has demonstrated leadership by doubling the psychological coverage in the insurance plan it makes available to its own employees. We hope that this will serve as a model for other employers to make similar commitments to the health and well-being of their workers and workplaces. That said, more needs to be done. Removing barriers to accessing care, clarifying tax law, and addressing conditions of work for publicly employed psychologists would go a long way to making psychological care accessible to Canadians who need it. Thank you very much. Dr. Mothersill and I will be glad to respond to questions.
Were implemented, how long do you think it would take before you saw changes?
We commissioned a report this year from a group of health economists to cost out models to enhancing access. I think it probably depends on what model is adopted. Some of those, there's things that employers and insurers can do in the private space, and then there's things that can be done in the publicly funded space. One thing's for sure, it would create better access to publicly funded care than we have now.
As soon as you get the practitioners into the clinics, they can begin to provide these much-needed psychological services immediately. There are personnel available out there. We just need to get them into the right clinics to see the right patients at the right time. And unfortunately, there's often long wait lists for services, and so anything that's going to reduce those wait lists will be able to provide the services in a more timely fashion, because often things don't get better on their own, and so you can reduce the degree of difficulty, you can reduce the chronicity, the potential for chronicity of the psychological services if you can get people on the ground.